wake up to several messages and videos on WhatsApp and Facebook about what to eat, what to drink, what not to eat in order to prevent COVID-19 or treat the infection. My name is Dr. Hiba Araba Osekwesi. I am a nutrition researcher based in the UK. Everyone you see on this video is a researcher, either in public health or nutrition, and we've come together to talk about some of these issues trending on social media. I'm going to start with the first one that says, is garlic effective in the treatment and prevention of COVID-19? Garlic has antimicrobial and antiviral properties, as most of us are aware. Now, there's been a lot of research to look at the effect of garlic on the common cold. And some of these studies have actually shown that continuous intake of garlic can prevent or lower the incidence of common cold. Now, a systematic review that was conducted not too long ago to look at all these studies, so systematic reviews bring together a number of studies on a particular question, concluded that there wasn't enough evidence to show that taking garlic or garlic supplements was effective in the prevention of common cold. Now, COVID-19, as we all know, is new, COVID-2019, so we don't have enough evidence. We don't have any evidence to show that taking in garlic or garlic supplements can actually prevent or treat COVID-19 infection. We don't. Now, that is not to say that we are discouraging people from taking garlic or garlic supplements. No, that's not what we are saying. In fact, what we actually encourage is not just garlic, but all those other foods that are rich in antioxidants, so garlic, ginger, turmeric, are things we should use in our daily food preparation. I think what we don't want people doing is to just think that garlic on its own or garlic and onion as a concoction can be drank and that will treat or prevent COVID-19. I actually saw one video where the person was saying you could just cut it into pieces and bathe with it or leave it in your bathroom or your house and it would kill the virus. There's no evidence for some of these revelations, okay? So what we say is, by all means use them, but don't focus on just these things or these concoctions. Let it be part of your balanced meal. Focus on a healthy diet. And together, we are going to fight this infection.
Hi, my name is Dr. Tokumbo Olayanju, and I'm here to address the myth that increased intake of orange juice will reduce our risk of contracting COVID-19. The best way to reduce our risk of contracting COVID-19 is to stay home and have good hygiene practices. Staying home will reduce our risk of exposure and then reduce the risk of contraction. Now, orange juice, along with other citrus fruits, are very good sources of vitamin C. Vitamin C is a micronutrient which is known for its antioxidant function, which means it helps to protect our cells and our tissues. And it's also known to actually support our immune system. Now, there is no study that has categorically told us that increased intake of vitamin C will reduce our risk of being ill from infections. Nevertheless, studies have told us that inadequate intake of micronutrients, not just vitamin C, would increase our risk, would predispose an individual to being ill as a result of infections like COVID-19. So what we want to do is to optimize our immune function, and to achieve this, we need to make sure we are resting adequately, we need to make sure we are exercising daily, we need to make sure we are living a healthy lifestyle, no smoking, responsible alcohol intake, and we need to make sure we're eating healthy. One of the important factors of eating healthy is to ensure that we're eating a variety of fruits and vegetables. Eating variety of fruits and vegetables will give us the opportunity to take the many micronutrients that are required to support our immune function. So remember, the aim is to optimize our immune function, and one of the ways to do this is to make sure we're eating variety of fruits and vegetables. Thank you.
Hello, my name is Dr. Gertrude Nsoma Nyaba, and I address the perception that people of African descent are immune to coronavirus. This is not true, particularly as people with pre-existing medical conditions such as asthma, diabetes, and obesity are more vulnerable to coronavirus. This is because their conditions weaken the body's immune system. That is, the immune system is already fighting a long-term illness, and so it is unable to fight off the coronavirus infection as quickly and as effectively as possible. Studies show a high prevalence of diabetes, obesity, and hypertension among people of African descent. So, for instance, in the RODAM study, RODAM stands for Research on Obesity and Diabetes Among African Migrants. It was found that diabetes, obesity, and hypertension are very common among Ghanaians living in Ghana and Ghanaians living in Amsterdam, Berlin, and London. Even worse, most Ghanaians with these conditions had their illness poorly controlled due to a host of factors. This means that if they are exposed to coronavirus, their immune systems are least likely to be able to effectively and quickly fight off the infection. So now you know, we are not immune. So stay safe, stay calm, and protect yourself from coronavirus. Also, if you have a neighbor with any of these pre-existing conditions, please help keep them safe. And if you know anyone who has had the coronavirus, please do not stigmatize them. Let's help keep each other safe, because the world needs us alive.
It's Dr. Evans Atia Asamani. I am a nutritionist and a public health researcher based in the UK. I'm here today to address the myth that increasing vitamin D supplementation could prevent or cure the coronavirus. Vitamin D, as is commonly called the sunshine vitamin, is predominantly gotten from the sun. Our bodies are able to synthesize vitamin D from the sun through the skin. To complement this, food sources such as oily fish, mushroom, eggs, and some fortified cereals are good sources of vitamin D. Unlike most African countries where people enjoy sunshine all year round, some countries such as the UK have less sunshine. Hence, the government recommends that people should consider taking 10 microgram of vitamin D supplement daily, especially people with darker skin, as they are unable to synthesize or to get enough vitamin D from the sun. Now let's look at the link between vitamin D and diseases. Vitamin D, good levels of vitamin D has been shown to improve immune health, reduce respiratory conditions, and improve overall lung function. Regarding the coronavirus, a recent study has shown that increased vitamin D levels is associated with reduced risk of contracting the coronavirus. However, this is in cows. In humans, there is no evidence that suggests that increasing vitamin D levels above recommendation could prevent or cure the coronavirus. So at this point, it is not advisable to increase vitamin D intake above recommendation. So together with the government advice of staying at home and keeping good personal hygiene, let us improve our eating habits, eat well varied diet, and keep well hydrated. With this, we'll be providing our body with the essential nutrients to boost our immune system, to stay healthy, and to stay away from diseases. Thank you.
Hi everyone, my name is Dr. Bisala Balulu Katon, and I am a public health researcher. So today I'll be addressing the misconception that 5G is associated with COVID. Well, 5G is literally 5th generation of wireless communication technology supporting cellular data networks. So all it would do is increase significantly your internet speed. So unlike 3G and 4G, it's a step up 5G. So there is no evidence that there is an association between 5G and either the spread or transmission of coronavirus. What you need to do to stop the spread and transmission of coronavirus is to stay at home. So do not leave your house unless for very limited purposes such as food shopping. Wash your hands with soap and water regularly for at least 20 seconds, and especially when you've left your house and you've come back in. Cover your mouth and your nose with a tissue paper or with your elbow whenever you cough and you sneeze. Also avoid as much as possible touching your face, especially when your hands are unclean. And finally, just avoid or ensure that you keep at least 2 meters distance between anyone that is not within your family unit. I hope this has cleared the misconceptions about the association between 5G and COVID. Please stay well and keep well.
Hello viewers, my name is Dr. Robert Akparigo. I am a public health researcher and a registered nutritionist. I've seen a number of videos that are being spread through social media and other communication channels related to alcohol use and the COVID-19 infections. Some of these videos carries false claims that include drinking alcohol can protect you from the coronavirus, or mixing alcohol in your bathing water and bathing with it will protect you from the coronavirus. And some even claim that mixing alcohol in body creams will protect you from the coronavirus. These are all myths or misinformation, as there is no scientific evidence supporting these claims. Excessive intake of alcohol compromises the body's immune system and increases the risk of adverse health outcomes. When your body immune system is compromised, you are unable to fight any infection, and that includes also the coronavirus. So keep a healthy immune system and lower your risk of contracting the virus.
So remember to include all your vitamin-rich foods like mango, pawpaw, sweet-fleshed orange potatoes, dark green leafy vegetables like spinach, contomere, cassava leaves. For vitamin C-rich foods, there are tangerines, oranges, amongst others. There's also for vitamin D-rich foods, there's oily fish like salmon and mackerel, then fortified cereals and beverages and milk. For antioxidants, there's turmeric, rosehip, there is ginger and garlic. For prebiotics, foods that are rich in prebiotics, there's plain yogurt, there's cheese, there's mushrooms and pickled vegetables.